You know, it's easy to think hyperbaric chambers. You just think scuba accidents, right?
The classic image.
But get this. Back in the late 70s, the U.S. had, what, fewer than 30?
Something like that, yeah. Very few.
Now, around 3,350.
Mhm.
And most are in hospitals now, or affiliated centers.
That jump is massive.
It really tells a story, doesn't it? Their role has shifted dramatically. It's way beyond just the bends now.
And what's really interesting there is how that growth lines up perfectly with us figuring out how hyperbaric oxygen therapy helps with, well, a whole lot more medical conditions.
Okay.
And that really brings us right to our topic for this deep dive, clinical hyperbaric facility accreditation.
Right.
We're digging into chapters from hyperbaric medicine practice in this document, 01.pdf. We want to understand why accreditation came about, what it actually, entails and the impact it's having.
Exactly. So think of this as like your shortcut to understanding a pretty complex but definitely increasingly important bit of healthcare. Whether you're in the medical field or just curious about how we ensure quality and safety in these specialized treatments, this should give you the essentials.
Yeah.
Our mission today is pretty clear. Get why hyperbaric accreditation started, figure out the nuts and bolts, and see why it matters for patient care, for safety.
Let's do it.
So let's unpack it.
Yeah.
Where did this whole push for accreditation even begin?
Well, like we said, you had this explosion in the number of facilities.
Right.
And naturally, more facilities meant hyperbaric oxygen was being used for more and more different conditions.
Makes sense.
This growth, while great for access, obviously started raising some pretty important questions like, how do we keep standards consistent? Quality, safety, across all these places.
Yeah, you absolutely need some kind of baseline. More places doing more things.
Yeah.
You've got to ensure everyone's operating reliably.
Precisely. And the Undersea and Hyperbaric Medical Society, the UHMS, they really took the lead. Back in 2000, that's when they set up their accreditation program. And the key thing is, it wasn't like reacting after things went wrong.
Proactive.
Exactly, proactive. They were looking at the growth
Yeah.
and trying to get ahead of potential quality and safety issues.
Smart. Looking ahead, setting a benchmark early, but was there like a specific trigger, a report or something that maybe lit a fire under it?
Yes, actually. Same year, 2000, October. The Office of the Inspector General, the OIG within HHS,
Health and Human Services?
they put out a report specifically on hyperbaric oxygen therapy. And it raised some pretty big red flags.
Oh, like what?
The OIG found inconsistencies, how treatments were tested, monitored. It cast some doubt on the overall quality of care people were getting.
Okay, that's not good.
And they also pointed out that the guidance from what was then HCFA Healthcare Finance Administration, now it's CMS,
Right, Centers for Medicare and Medicaid Services.
the guidance coming from them to the hyperbaric community was pretty limited.
Okay, so inconsistent monitoring, not enough clear guidance. That does paint a concerning picture. What did the OIG actually suggest doing about it?
They had several key recommendations. They said HCFA should create a national policy for covering hyperbaric oxygen therapy,
Makes sense.
improve guidance with clear practice guidelines, clarify the rules about physician attendance during treatments,
Important details.
and step up oversight, make contractors do more thorough reviews. They even floated the idea of a national database of facilities and the doctors working in them.
Wow. Okay, so that sounds like a call for much more government involvement. So the UHMS accreditation program was, what, a direct answer to that OIG report? Oh, wait for the field itself to step up?
Exactly. By setting up this national clinical accreditation program, the UHMS was basically saying, hey, we see the concerns, we're on it.
Right.
It showed regulatory bodies that the hyperbaric community was actively working to ensure consistent quality and safety. It was, self-regulation in action, showing commitment to high standards.
That's a really key point. They didn't wait to be told. They took the initiative. Okay, so we get the origins now, but let's dig into why it's so important. What are the real tangible benefits for a facility that actually goes through this?
Oh, the advantages are pretty substantial. They touch almost every part of how a facility runs. First and foremost, improved quality of care. That's the big one.
Naturally.
The whole process forces facilities to look at best practices, stick to established standards, and that leads directly to better, more consistent patient outcomes.
That's the core, isn't it? If you're aiming for accreditation, you're going to make sure your procedures are solid, evidence-based. What else?
Well, tied right into quality is enhanced patient safety.
Crucial.
The standards cover a ton of safety protocols, meticulous equipment checks, clear emergency plans. It just creates a much safer environment for patients.
Okay.
Accreditation can also make the place run more efficiently, help with risk management, and it's a clear sign, a symbol, that you're meeting codes and accepted practices.
So better care, safer place, runs smoother, looks more credible. Those are strong arguments. Any other practical upsides?
Absolutely. Some places might even see their liability insurance premiums go down
Oh, interesting.
because they're showing that commitment to safety and quality.
Uh,
It can also be a real boost for staff morale. Working in an accredited place gives a sense of pride, professionalism.
I can see that.
Plus, it helps with public relations, marketing,
Mm-hmm.
and often makes it easier to hire and keep good staff. People want to work at a reputable center.
Right, so it's not just about compliance. It makes the facility better for everyone, patients, staff, management. You mentioned non-affiliated outpatient places specifically. How does it help them?
Yeah, for those standalone outpatient centers, accreditation can be absolutely vital. It really helps build their credibility with other doctors, the professional community.
Oh, so?
Well, think about a doctor referring a patient for hyperbaric treatment. If they see a facility has UHMS accreditation, that gives them a huge amount of confidence in the care quality and the safety there.
Ah, so it's like a seal of approval. Builds trust with referrers.
Exactly.
And you said earlier this puts hyperbaric medicine more in line with other specialties.
It does. Accreditation elevates the whole field, makes it stand alongside specialties like, say, radiation oncology or rehabilitative medicine, which have had strong accreditation programs for ages. It signals professionalism, dedication to getting better.
Okay, we've got the why. Now the how. What's the UHMS accreditation process actually look like? What do they focus on?
It's pretty comprehensive.
Mm.
The main focus areas combine national codes and standards, the ones really relevant to hyperbaric medicine and running these specific facilities,
Right.
and also quality improvement principles, things drawn from established bodies like the Joint Commission, others like that.
Okay, so they're building on existing respected guidelines, not starting from scratch. What kind of national codes are we talking about?
Think about crucial safety standards, like the National Fire Protection Association's NFPA 99, that's the Healthcare Facilities Code, and NFPA 101, the Life Safety Code. NFPA 99 deals with medical gases, oxygen storage and delivery, fire safety inside the chamber, really core patient safety stuff.
Directly relevant.
Exactly. And then there's the ASME PVH01 standard from the American Society of Mechanical Engineers that governs the chamber itself. Design, build, pressure testing, making sure it's structurally sound.
Makes sense.
They also bring in guidelines from the Compressed Gas Association for handling gases safely.
So really hitting the fundamental safety and operational pieces. What about the people? Staff training, qualifications?
Oh yeah, that's a big part of it too. The program has standards for staff training, certifications, how physicians are credentialed and overseen, ongoing education.
Uh-huh.
A lot of that is based on the UHMS's own guidelines for hyperbaric facility operations. All told, they assess facilities across 24 different concentration areas.
24. Wow, that sounds incredibly thorough. What else is in there besides safety and personnel? Give us a few more examples.
Sure. To give you a feel for the scope,
Mm-hmm.
it includes things like governance and administration, how the place is structured and managed.
High-level stuff.
Right. Then patient rights, patient assessment, making sure care is ethical and appropriate right from the start, the actual patient care environment, patient education, quality improvement programs, HR information management, even clinical research if they do that.
It really sounds like it covers the whole shebang from top to bottom. So how does the facility actually get evaluated? What's the survey like?
Okay, so the survey itself is done by a voluntary team. 3 pros, really experienced in the
What
field.
is on the team?
A board-certified hyperbaric physician, a board-certified hyperbaric nurse, and a board-certified hyperbaric technologist.
The key roles.
Yeah, exactly. They spend 2 full days at the facility.
2 days. That's intense.
It is. They meticulously go through all 24 of those concentration areas, checking compliance.
And after those 2 days, what happens then?
The survey team writes up a detailed report, lays out their findings, highlights any areas needing improvement, maybe some requirements.
Okay.
But here's the thing. The team doesn't make the final call on accreditation.
Ah, okay. Who does?
That's up to the UHMS Accreditation Council, the AC. It's a diverse group within UHMS, physicians, nurses, technologists, ensuring a balanced view.
So the surveyors gather the intel, but a dedicated council makes the final judgment. What are the possible decisions from the AC?
Several possibilities. They can grant full accreditation, usually for 3 years,
Standard outcome.
or they might grant accreditation but require the facility to submit a written plan of action for specific issues they found.
Right, fix these things.
Sometimes full accreditation only comes after that plan is done and approved. Then there's accreditation with distinction.
Ooh, sounds good.
Yeah, that's for 4 years. It means the facility really knocked it out of the park, exceptionally high performance. And of course, they can also choose not to accredit if major standards aren't met.
Okay, that distinction level really seems like a badge of honor. So, with all this effort behind the program, what's the score? How many places in the U.S. have actually achieved accreditation? Well, the numbers we have are up to the end of 2016. At that point, UHMS had accredited 252 programs total.
Okay.
That included 3 international ones, so 249 in the U.S. And of those, only 8 were standalone, non-hospital facilities.
Interesting. Mostly hospital-based then.
Right, which means back then about 17% of the estimated 350 hospital-affiliated programs in the U.S. were UHMS accredited.
17%. That's...
Well,
Well, it's significant, especially since you said participation is mostly voluntary.
mostly, yes.
Are there any cases where it's actually required? Mandatory.
Yes, a couple important ones. Starting way back in 2006, Utah Medicaid made UHMS accreditation a requirement for facilities to get paid for hyperbaric treatment.
Ah, a state Medicaid program mandating it.
Exactly. And more recently, 2014, a payer called Mohawk Valley Physicians, or MVP,
Uh-huh.
they started requiring facility accreditation for their members needing hyperbaric therapy in parts of New York, Vermont, and New Hampshire. They even said doctors had to be on staff at an accredited place to get reimbursed.
So money talks. Payers are starting to use it as a lever. What about the big one, Medicare? Any movement there? Have they recognized the UHMS program formally?
Well, it's not a nationwide requirement yet, but Medicare has seriously considered UHMS accreditation. That's a huge deal.
How so?
Back in 2013, a major Medicare administrative contractor, Novita Solutions, they handle claims in 11 states, they put out a draft local coverage determination, an LCD, for hyperbaric oxygen.
Okay, an LCD dictates coverage rules for a region.
Right. And this draft actually proposed making UHMS accreditation mandatory for Medicare to pay for treatments in their areas.
Wow. Mandatory accreditation for Medicare reimbursement. That would have been a massive endorsement. What happened? Why wasn't it in the final version?
Yeah, the mandatory part didn't ultimately make it into the final LCD.
Yeah.
But the very fact that a major Medicare contractor even proposed it, that's powerful.
The strong signal.
It's a huge acknowledgement of the program's value and its potential link to Medicare payment down the road, maybe on a bigger scale. A lot of people in the field see it as a sign of where things are likely headed.
Definitely sounds like accreditation's importance is really gaining momentum. Now, the material also mentioned something interesting. Opportunities for improvement that came out of the accreditation surveys. What were some of the maybe surprising findings there?
Okay, yeah, this is where it gets really interesting and maybe a bit concerning in some cases. One of the most surprising and common issues was around physician privileging.
Privileging, meaning who gets approved to do what?
Exactly. UHMS surveyors often found facilities had weak policies, or sometimes no real policies, defining the qualifications needed for doctors to practice hyperbaric medicine there. They even found cases where doctors were supervising treatments without having any specific hyperbaric credentials themselves. Yes, and in one really worrying instance, a hospital was letting doctors with zero formal training in the specialty practice hyperbaric medicine completely independently.
That is genuinely alarming. You just assume.
Well,
You'd assume the doctors overseeing the specialized stuff would have specialized training and credentials.
you would think so.
What other improvement areas popped up?
Another big one was the lack of formal proctoring for physicians new to the field or just new to that facility.
Proctoring, like supervised practice.
Yeah, it seemed like just taking a basic intro course was often enough to get full, unsupervised privileges, which is, quite different from how many other medical specialties handle new doctors. They usually have some mentorship, some oversight period.
Right. So it sounds like real inconsistency in making sure physicians actually have the baseline expertise needed. Any other unexpected findings?
Yes. The consistency or lack thereof of continuing medical education, CME, specifically in hyperbaric medicine.
Keeping up to date.
Right. Surveyors often found doctors who'd been practicing for years but hadn't done any hyperbaric-specific CME since their initial training way back when.
That's not ideal.
It really raises questions about whether They're current on the latest advances, the best practices, safety protocols. It's a field that evolves like any other.
Absolutely critical point. Medicine changes constantly. Ongoing learning is essential. What about the rest of the team? Nurses, technologists?
Well, there's been progress there, but the UHMS found that specialty board certification wasn't yet standard practice everywhere.
For nurses, that's the CHRN, Certified Hyperbaric Registered Nurse.
Correct. And for allied health folks, it's CHT Certified Hyperbaric Technologist.
Okay.
The numbers of certified people have been going up, which is good, but there's still room to grow. UHMS really pushes facilities to make board certification either a requirement for hiring or at least a clear goal to hit within a set time after starting.
Aiming for a more uniformly qualified team across the board. Makes sense. What about safety protocols? You mentioned the safety director role earlier.
All right, another key area, NFPA 99, that code we mentioned, mandates a designated hyperbaric safety director for each facility.
A specific person responsible for safety.
Yes. But surveyors often found these designated people weren't fully stepping into that role, especially in the non-affiliated standalone centers. And even in hospital programs, many safety directors weren't really managing a comprehensive safety program that went beyond just basic fire stuff.
What kind of things were missing? What specific shortcomings did they see?
A really common one was not doing regular, varied emergency drills, not just fire drills.
Like what?
Procedures for handling critical events like a sudden loss of chamber pressure, or a power outage during a treatment, communication system failure, contaminated breathing gas getting in by mistake.
Wow, serious scenarios.
Exactly. Often, the plans were either missing or the team hadn't actually practiced them regularly.
Practice is key for emergencies.
Absolutely. On the upside, the report did note that more specialized training programs are becoming available specifically for hyperbaric safety directors
Yeah.
to give them the tools they need.
Okay, so it sounds like the accreditation process itself really surfaced some critical issues, which hopefully leads to safer care overall. Now let's talk external recognition. You mentioned the Joint Commission before. How did they view the UHMS program?
Right. The Joint Commission, or JC, major accreditor in the U.S. healthcare scene, they have something called the Cooperative Agreement Program.
Okay.
It's basically set up to formally recognize other accrediting bodies in specialized areas where JC surveyors might not have that deep technical know-how.
Like hyperbaric medicine with its unique tech.
Exactly. The chambers, the specific operational stuff, it fits that category perfectly. And the UHMS is, quite rightly, proud that their clinical hyperbaric accreditation program is one of only 4 programs that the Joint Commission has formally endorsed like this as a complementary accreditor.
That's huge validation. A major player saying, yes, the UHMS program is rigorous and expert. Any other external recognition worth noting?
Yes, actually.
Yeah.
The UHMS Clinical Hyperbaric Facility Accreditation Program has a pretty unique distinction. It's the only ISO 901.208 certified hyperbaric facility accrediting program anywhere in the world.
ISO certified. What does that mean in this context?
ISO 9001 is all about quality management systems. So that certification means the UHMS program itself adheres to internationally recognized principles for things like continuous process improvement, having robust quality controls within their own accreditation process.
So it's not just about the clinical standards they check, it's about ensuring their own process for checking is high quality, efficient, and effective. Very meta.
Exactly.
And finally, the material mentioned international expansion briefly. This isn't just a U.S. thing, then.
Oh, absolutely not. While the UHMS program was definitely a major driver, the British Hyperbaric Association actually had an earlier accreditation program.
Oh.
And the success of these kinds of programs has sparked a lot of interest internationally. You now see accreditation efforts popping up or developing in countries all over: South Africa, Brazil, Canada, across Europe, Southeast Asia.
A global trend towards standardizing quality and safety in hyperbarics. Is the UHMS involved in that global spread?
Very much so.
Yeah.
Especially in countries where maybe the professional societies or specific hyperbaric codes are still developing. Leaders there are often looking to UHMS for guidance, even for accreditation.
Makes sense. They have a proven model.
Right. And as an international society itself, UHMS has shown it can adapt its process for different countries, different regulations. They've proven the standards work internationally.
Where have they accredited outside the U.S.?
So far, they've accredited programs in Brazil, Canada, and Thailand. And they're talking with facilities in other places too, like Singapore and Saudi Arabia, really broadening that international impact.
Okay, so pulling this all together, it really sounds like hyperbaric facility accreditation, well, maybe not something everyone thinks about, has quickly become a truly vital benchmark for quality and safety in what's clearly a growing area of medicine.
That sums it up perfectly. It started as this proactive move by UHMS to get ahead of concerns, set clear standards.
Right.
And it really has become a crucial way to ensure quality, ensure safety. It pushes individual facilities to improve, sure, but it also gives confidence to patients, to doctors referring them to the regulators.
And even with all that progress, as those opportunities for improvement showed, there are still challenges, still work to do within the hyperbaric community.
Exactly. Getting to optimal quality and safety. It's never really done. It's a continuous journey. And the UHMS accreditation program is a key framework for driving that improvement, pushing for the highest possible standards for patients.
So, for you listening, as we wrap up this deep dive, think about this. We've looked closely at how quality and safety get managed in this very specific medical field. But doesn't that make you wonder about the bigger picture?
What are the implications of having these kinds of rigorous, specialized accreditation standards across all of healthcare? Should we see more of this kind of detailed scrutiny in other specialties? And maybe just as importantly, should patients like you have a clear understanding of what these accreditations mean when you're making healthcare choices? Definitely something to mull over.